where we're going to go is we're going to look here at the shortcuts and applications, and we're going to go to the EPOCH site. And so once we get here, we really have two ways of going off and looking at Joanna Briggs. We can look on the side here in that quick list, and you can see the little link that's there. And we can also see from the side just here that you have access to Joanna Briggs from inside that evidence-based practice list. Both of these links are going to take you to the same place, but it's really, I guess, emphasizing the importance and the placement of this resource as part of evidence-based practice. This is really what it's about. If I click on to the link like that, it opens up a new screen which looks like this, and I just have to make it a little bit smaller because of the projector so that it fits on the page, but you won't have to. It will fill the entire screen and you'll be able to use it as it sits just here. This is a page that we hope brings to you all of the things that you need to access this database properly and to encourage you to go in and use it, because it has in it the toolkit for you to help you to understand the content and to understand the software and the way that you can use it. On the side here, in that blue box, this is the way that you can begin to search inside this information in a very simple way. And in the past, maybe this has been something that kind of held people back because they found it kind of tricky and it was difficult to get into. And it's none of these things just now. It's really easy, if you just want to look for a simple subject, to use that box there. Next to that box is a little button where you can actually go in and look at the Ovid SP software. And you may have used this from your days in college or in university. This is something that is that may be familiar to you. So, if you've tried it before, go in and have a go. Down at the bottom, you have some instructional materials. There's a little video and some other items which are there. Are we allowed to watch video inside the hospital?
Yeah, it shouldn't be a problem.
Okay. Some places can, some places can't, but I think we'll be all right there. And then over on the side, on this side, you have access to some of the tools. And we're going to talk about the tools a little bit towards the end, so we can appreciate what's inside there and maybe go in and explore the possibilities there. Let's start by doing a search. And from my talk yesterday, I have some subjects that we can explore, but I want to maybe ask one of you whether you have a particular topic that you'd like me to try. Have you a suggestion? The one from yesterday was somebody was looking for falls in the bathroom. So I thought, how interesting, because it's an issue, it's a problem, and it may be perfect for this sort of database, because this database and its content are about practical problems that people have and how we can go about avoiding these difficulties. Sometimes what we have in research is we have these really complex and detailed problems. Here we're looking at maybe a different sort of resource for a different sort of set of questions. And so this is what we might try just here. If I was going to do a search on falls, I could just type in falls into that box just here. And down below there, you can see that pull-down menu, which tells you about the sorts of publications which are in this database. And you may be familiar with these from before, when you've used these publications. The main ones that make up the majority of this database are these two, the evidence summaries and the recommended practices. They make up about 75 or 80% of this database material that you find inside here, and they are really the focus of this information. An evidence summary is the summary of a small subject area which looks at all of the evidence supporting the interventions that are to do with that small topic. A recommended practice is like a practice guideline, and so what you would expect to find inside there would be a list of the equipment that you might need, the steps that you might go through, and how you might actually perform that task, because often it's a task, it's something that you do for a patient. And then attached into both of those are all of the important evidence materials that supports the steps, or that support the practice that is described inside that material. So we're not just making a recommendation, we're saying the reason why we're making this recommendation is. So what somebody has done is they've gone and they've found all of the clinical trials, the randomized control trials, the systematic reviews, all of the material that's been published at a high level about that item, and then they've taken that and they've summarized it and they've made it accessible for people. And so it's really a way of taking research and putting it into practice, which I think is a really cool thing to do. Down through the bottom there, we also have the subject area nodes. And this list is bigger than it was last year. So what we're seeing is that the size of this database and the content and the subjects which are covered by this database is becoming larger and larger as time passes. And this is because of the demands that come from people like you, and also because of the interest of people outside of these organizations looking in and seeing, you know, how effective these items can be. The ones that have recently been added: tropical and infectious diseases. Maybe you don't get so much of that in Tasmania. But also physio and pediatrics, and the community health area is very much expanded. So those ones are new or expanded ones. And what we're expecting this year is that there will be a big and important new node, which is part of this subject list, which is the renal node. Because kidneys and kidney transplantation are a really important topic, and this is something that is going to be a new focus of this database material. You may see inside that list the sort of information that you might be interested in. For example, surgical services. You know, you guys could be looking at that particular part. You know, the quality improvement, people may be interested in all or most of this. So, you know, you can see your particular subjects listed there. It's a way of narrowing down to a particular item. If I do a simple search, though, by clicking on that button, what it takes me to then is it takes me to a list of results. So they're there, and for every single one of these, you get access to the PDF document which is attached to that choice. So this could be a very simple way in which I could find out about a subject, and I could zoom immediately into that result. And what I'm really telling you is that this doesn't have to be a complex question. This can be something really, really easy. The main difference between the results that we see here and the results that you might have seen when you used that Connect Plus version of this software is that it has an extra part that's added into the search that may help you to find your area of interest. When we used Connect Plus, it was mainly focusing on the title of the article. When we are using the Ovid version, it doesn't just concentrate on the title, it actually includes the document itself. So you are searching inside the full text. The reason why this is important is that sometimes these items are about comparisons. And maybe sometimes what you want to do is you can want to compare different types of interventions. You want to say, do I use acupuncture? Do I use TENS? Do I think about, physiotherapy or something like that? And if you're searching inside the document itself, it may sometimes be about a comparison, that one is maybe a little bit better than the other, or one is better supported than the other. So this is something that will help you. And it's not a massive database anyway, so you would see that reflected in the results. Over on the side here, and I know it's tiny, tiny writing, but it tells me how many results there are, and it tells me the thing that I searched. I just searched in falls. I might turn the light off so it might be a bit clearer. Just hang on. Can you see it back? Or is that...
Again, can you see it?
Okay. You can all move forward. You can all move closer to the screen if you want. Okay. I'm just pointing here. There's about 200. And it's about falls, and you'd be able to see this if this was your laptop. And this is where you're going to go to look at the PDF of that item. Something that's new from this display, though, is that over on the side there, you can also see a little link, which wasn't there yesterday, that says topic request. And so this is really a message back to you. So if you've looked through these results and you've found, oh, there isn't one that is about my subject area of interest, you can actually send a message to the Institute itself, and you can request that that new topic be included as part of the database. So really what you're doing is you're starting a conversation with the Institute. You're starting a conversation with the people that write these materials. And that, I think, will help you. On the page here, we can see in that area for each of these documents what type of publication this is. And you're going to have to believe me that for most of these are evidence summaries, these are recommended practices, those two different types of publications that we talked about. And the question often is, why do I see them in this order? And the answer to that question is on the screen there at the bottom. These are in update or publication order. And so what this is about is that somebody doesn't just write this material, then push it out the door and that's your lot. What they do is they continually update these documents. So every few weeks, somebody has gathered up the publications that have recently been published about that subject, and they make sure that it's current. And so that date there tells you about this process and how it's continually being updated. Most of the evidence summaries and recommended practices are updated every 2 or 3 months, or at least somebody has looked at them, so you can know that this is very current material. So looking down through the list here, you can see that these are about falls. Often these are about the ways that people are being cared for, or about assessments, or about the circumstances that lead to falls, either during using the bathroom or the sleeping arrangements, or those sorts of things, just here. Okay. what I could also have done for that same topic is I might have picked out of that question that somebody had asked, bathroom, as maybe it's the circumstance that's causing this problem. You know, a damp floor, something that's slippery. And I could add into that I only want to look at evidence summary. So this is going to narrow down my search, and it's going to give me fewer results. If I look over on that side again now, and you probably can't see at the back, but it says 8. So there are a lot fewer results, really because of those 2 steps that I've taken. I've picked out another topic. I'm looking at narrowing it down to those different sorts of information that you see there. And then, so things like bathing and showering, pediatric patient falls prevention, those sorts of things are the documents that you see there. And the main way that we're finding these is that we're actually looking inside the document itself, and it's mentioning that the circumstance for this problem is the bathroom itself. Is that cool? Yeah? So by going around this in a different route, you're going to get a different sort of result. Is that cool? Just to begin to show you then what these look like, if I click onto one of those items there, and I go past the complex protection and open that document, what you see is that evidence summary. So let's have a look at that individual document and see what it's made of. So up at the top here, it talks about the author. This is a little bit misleading in a way, because these are often written by groups of people who come together to create these materials. And this person that's measured as the author is really the person that's in charge of that group, and so is taking responsibility for this publication. There are about 70 places across the world that are involved in writing these materials. So 70 contributing centres, and there is definitely some here in Australia, and there may be more just in a little while. So there is a question. This is the thing that we're looking at. There is a summary of the question and the things that lead to it, including the risk factors. And then attached into the documents that you see here, in each of these bulleted items, is a reference and the highest level of evidence for that individual discussion or indication. So you can look down and you can see listed out these choices. In each case, the little number, the level of evidence, and the summary of all of these different publications.
Could you explain what level of evidence means?
I'll show
okay.
you in just a moment. Yeah. This set of items that you see here, the levels of evidence and later on the gradings, these are an internationally approved way of telling you a story about these individual items. So how well supported that particular step is, or that particular discussion point is. So as we look down through here, you can see those items listed out. And then down towards the bottom of this document, it will tell you about what the characteristics of these individual pieces of evidence are, and they only list the evidence at the highest level for for that particular item. So these will often be something like a Cochrane review or an NHS review. In this case, World Health Organization document, a very important randomized controlled trial, or something like that, a systematic review. Then down through that, it will make a recommendation, and these are indicated at a grade. So the grade is telling you again about importance, and then it will list out the references. The references that are here are not the only documents, obviously, that are published about that individual item, but they've picked out the one that is the highest level. So they're being selective about these choices. What we're hoping to do very shortly is not just offer them here as a PDF document, but actually embed them into the database and link them. So we'll not only be able to explore the document and its conclusions, but we'll be able to move out and actually look at how people researched for it and the way that they came to those conclusions. So this is happening just now, and we'll see the signs of this as we move through the database. It's good that you mentioned, though, about the levels of evidence, because if I come back here, this is the search software itself, and also there is a copy of this on your landing page. Behind that little link there, which is the field guide, and I'll open that up, it does tell you what each of these documents is about, the recommended practice, the evidence summary, but it also shows you in a table those levels of evidence choices. So level 1, level 2, level 3, level 4, down to 5. And this is an internationally recognized description that you see here. And it also shows you the gradings as well, and what those mean. This is actually changing within the next few days, and this document will be updated about those changes. I think it's not really the way that it works, it's just the descriptions that are different in that new version. I'm going to go back, though, to here, and I'm going to click on again onto that button. Just to point where we were and what we did. So we looked at one of those types of publications, and you saw there the subject area nodes. Okay, I've just typed into the box catheter. When I search, though, I might want to just not search for that individual word. I might want to open up that topic and search for it in a larger way. And if you take one thing home from this experience today, is a recommendation. You'll be saying to yourself as you walk down the corridor, Allan says that I should always, if I want to open up that search, I should add an asterisk character to the end of my word. And so when I do that, what it does is it includes not only that word, but it looks at variations on that word. So this is catheter, catheterization, catheters, all of that sort of thing. What I might want to do then, because I know that this is a really common topic, is I might want to look at a type of publication. I might want to add on to that a subject area node. Maybe I'm looking at catheters as they are used in a surgical service and I want to find some practices. I want to find some guidelines about the way that they're used. So I guess we're making our search step by step a little bit more complicated and a bit narrower. So I can tell you, because you may not be able to see at the back, that says 68 on the side there, and it does give me a little bit of a summary behind my choices there. So these ones, for example, are about central lines and the way that they can be inserted and removed. And so what you might want to do is to look at an example. And the way that these look is a little bit different from the ways that those evidence summaries look. Because an evidence summary is a summary about a small subject area and maybe looking at some different sorts of interventions. A practice guideline is something that you actually do. It's a task. It's something that you perform for a patient. And so what it's going to tell you is it's going to say, this is your equipment pack. This is what you need. These are the things that you are going to do. Often it's in a step-by-step format. And so for somebody that's not done this before, that wants to look at this as a procedure or see some recommendations, this is how you might do that. And then down attached to that are those documents that we saw before, looking at the evidence that supports the steps that you're following. So it is really the bridge between the research that's been done and how you put that into practice. And that's really the idea that we're seeing there. Is that cool? Mm-hmm. Yeah. This is really the message, I think, in that the whole philosophy of the Joanna Briggs Institute is to break down the barrier between what people have found when they've done these important trials and what people actually do in practice, and to bring these together and to improve patient care.